So talk to me a little bit about the role of competition here. You've talked about the need for a free coronavirus vaccine across the world. Um, but there are many people who would say that competition, driving competition among the companies that came up with these vaccines was crucial. How would you have re-engineered what went on in the creation of vaccines? How would you like to have seen it done?
Well, first of all, I mean, when we look at vaccines, we should really also just broaden our gaze to the whole health sector in terms of how we innovate within it. There's huge amounts of, public money. For example, in the U.S., the National Institutes of Health spend every year close to 40 billion just on, health innovation. And of course, there's lots of, private pharmaceutical research companies like the ones that are in the media these days, like Pfizer, of course, is innovates, but they innovate within an ecosystem. And what we've gotten wrong in the past, and we can't get wrong now with the vaccine, is that how we've then governed that innovation system has been really lacking. For example, intellectual property rights, patents, are often abused. They're often too wide. They're just used for strategic reasons to keep competitors far away, as opposed to really doing what a patent should do. They are too strong, so hard to license. They're too upstream, so the tools for research are being patented as opposed to just the downstream up product. And so, people have talked about this, but we just haven't managed to change it. And it's quite striking that even in a sector which receives so much, not only public investment, but a public subsidy in terms of the patent, right? Because a patent is actually a 20-year monopoly that the state grants the private sector. What the state gets in return is diffusion of that knowledge once the patent is up, as opposed to the secrecy, for example, that we had during the Middle Ages. But if in the meantime the patents are badly governed, then you don't even get that diffusion later because you've stifled the process of knowledge sharing. And so what's really critical right now with the vaccine is that we learn from these problems. And this is why the World Health Organization, for example, on the back of a push really from the Costa Rican government, have been arguing for having a voluntary pool for health technology around the vaccine, which would actually pool the patents. So there's a real knowledge sharing. And they use a word which I really love, which is collective intelligence. How do we foster collective intelligence by how patents are actually structured? So we're not just racing towards a vaccine in one place, but sharing as much as we can the knowledge globally around that.
You mentioned the
And
World Health Organization. I'm sorry, I didn't realize I was
no, no.
interrupting you. But you mentioned the WHO, and you've taken on an important role with a particular group within the WHO. Tell me what you have done to inform this and bring countries together on these common goals that you've been talking about to make health a shared value, a shared global value.
Sure. Well, first of all, this council that I'll be chairing, which is called the Council for the Economics of Health for All, will be bringing together global economists to really help the World Health Organization, think about the economic side of health for all. And it's, how it's been framed in the past was that you need to invest in health, so it's good for the economy. Or if we invest in health, then people are more resilient, they're more healthy, and that'll be good for the economy. We need to reverse that logic. We need to say that we need to actually invest in health and health for all, global health systems, which really we've all woken up to how important they are, right? Because we're only as healthy as our neighbor is, globally, on our street, in our city, nationally and globally. By investing in health for all and having that as the objective, then we need to backtrack and ask, well, what are the different systems, including the economic system and how we do budgeting, how we think about the role of innovation policy, industrial policy, public procurement, public-private partnerships, and the investment that's required in a health system seen as a long-run investment, not just a short-run increase in our cost, expenditure, the deficit. All those kinds of issues of long-termism and how we value a health system that we were talking about before really requires a framing, and we don't have that framing, or it's not as strong as it could be right now. So that's what the council will be doing, and it will be launched in January. But what I've been trying to do globally around this issue, and I'm writing about this, or I've written about it in this book that's coming out in 2021, is what does it mean to do exactly that, which is put at the center of economic policy a goal, right? So that it's not just about funding a health system in and of itself, but health for all, or the vaccine, if it has to be universally available and accessible, that's different from just saying race for a vaccine. So to have a goal-oriented form of policy is very different from just kind of dispersing funds here and there to small companies, to particular sectors, particular types of businesses, or particular types of even citizens. So, this is why I often go back to the moon landing, because that was such a huge global effort. It required lots of investment from both the public sector. Of course, it was led by the public sector, but there was lots of private initiative. There was companies like General Electric, Motorola, Honeywell, that were part of that, investment in innovation machine, which got us to the moon and back again in one generation, which was the goal that Kennedy set. So the real question is, could we be as ambitious as that and formulate really concrete goals that require that intersectoral investment in innovation, but around the biggest challenges that we have today, around inequality, around global hunger, around our oceans that are full of plastic, around climate change, polluted cities. And so to have this mission-oriented approach really requires redesigning policy in order to achieve that. And it means that the grants that governments give, loans, public procurement, or prize schemes are focused on outcomes. And I believe that's possible. And if it's not going to be done, then it's going to be really hard to solve these. I keep coming back to these SDGs because I want the world to remember how important they are, because we only set them 5 years ago.